Hello, I am István Javorek and I do conditioning for all sports, and one of the sports is golf, and golf needs really very serious conditioning, and the most important, preventing injuries. There are so many injuries could happen in golf, especially your elbows, your wrists, your shoulders, your knee, but the most important part usually is your abdominal part and then your back. So I developed several exercises which could help any golfers to prevent or to recover if they have a kind of back or knee problems. Okay? So I will show with a golfer, Aaron Lang, some exercises of back routines. I call JAVOREK'S back routines, which you can do it with lighter weights, of course, in the beginning, and gradually get heavier and heavier, be able to do no more than 10, 14 reps of all of those exercises, and then really you can prevent and then strengthen those joints, especially your back area. And then we start with the barbells and dumbbells, and then later on we do the abdominal routines. Thank you very much. Okay, pick up the weights and stand up. So this is the special good morning. And bend over and head up, shoulder blades. When you bend over, curve your back, C shape, and head down all the way. And then head up, shoulder blades, and shrug up. Go all the way down, touching your skin when you go down, and get up and shrug up. And do it one more. Close to you, and up, and put it down. Good job, put it down. So Aaron demonstrated, and now Clint McCullough also will demonstrate this exercise. So pick up the bar, and then when you go down, curving your back, head down, touching your skin, and then head up, shoulder blades back, and down. So go down and stay there down, and then head up first, stay there, and shoulder blades back in this way. Okay, and do it one more. So in this way you adjust the whole column on the right position. You stimulate all of the erector spinae muscles, and then we'll be recovering and also getting the whole column in the right position. Okay, so it's a very good exercise and stimulate all of the musculature of your back. Good job. Put it down, thank you. And actually go and demonstrate Clint, demonstrate the regular good morning, and you also. So the bar behind the head. On this one now you look up. This is the lower back erector spinae muscles. Come on. And you flex your knees and then get up and down. Yes. So don't get back, just stay up. Yes. Very important always to get the big stretching on your hamstring and then developing the lower back erector spinae muscles. Good job. Come on, Aaron, demonstrate also you. Thank you. Regular good morning, pick it up, put behind the head. And let's see. And go down and up. Okay, good. Stop up here and turn back all the way, turn back completely. Turn back, all the way back. Yes, I'm showing this way. So now keep going up and down. You see how much it works, all of these muscles here. Good job, put it down. Great job. Okay. Then the next exercise is, stay here, Aaron, behind the head press from half squat or quarter squat. So pick up the weight, step it forward, and stay there and press up. Good. Turn completely in other direction, turn back completely. Turn toward me, yes, and then get in the same position, and then leave it lower, bend your knees more a little bit, and you can see how much works these supporting muscles there, stabilizing muscles on his shoulders. Good job, put it down and rest. Okay. Then the next exercise, what I do from my back reconditioning exercises is the hyperextension. So the hyperextension on that hyperextension bench.
Okay.
Go, set up on the hyperextension bench, and then hook your feet, and do it just one or two for warm up. All the way up and down, and now do it pressing forward. Pushing up, right, as high as you can. Pushing up there. Great job. Great job. Get the speed in it, and then really improves your back musculature a lot. Good job. Thank you very much. So these are a part of my back routine. Then we go to the abdominal exercises. And then actually you need to strengthen your abdominal muscles. And any of these exercises on the beginning you need to do it very, very lightweight. Learn the proper technique, because it's no dangerous exercise, just dangerous techniques. Now we go on the golf back routine, abdominal routines, and then Aaron will demonstrate one of them, which is from 3 different phases. All of those information will be on the YouTube also, attached to it, so you can read it later on. Thank you very much. So I named this golf program JAVOREK'S, Aaron's and Addison's abdominal program. I named after them because they were practicing and experimenting with me this program. So it's 3 cycles. The first cycle with lighter dumbbells, second cycle heavier dumbbells, the third cycle with heavier dumbbells and medicine balls, okay? So hook feet and then weights on your chest, 15 sit-ups. When you finish, half up and up, half down and down. 15 times. Then holding the dumbbells in your hand, twist it right and left, crunches, and go. 1 and 1, and 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, 10. Come on, keep going. 11, 11, 12, 12, 13, 13, 14, 15. Now, almost the same exercise, but raising up like an upright rows and pushing down on both sides. Come on, pick it up, don't stop, and go. And all the way up your elbows, higher your elbows, right. And push them all the way to the ground. Touch the ground, pushing those. Yes. Yes, and then we do the medicine ball overhead pass. Good, and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and regular jackknives, 10 of them. And go. Good job. So, there are 2 more cycles, and with heavier weights, exactly same thing, just the exercises are changing on second and the third cycle with the medicine ball. So in that second cycle, medicine ball, chest pass, I demonstrate right now, come on, hook your feet. So the same cycle is exactly same with heavier weights, just instead of overhead pass will be chest pass, come on, and go down and pushing up to it, right. And then if it is good shape, I can push harder, or I can throw up and catch it in that way. okay? And then the third cycle will be both overhead pass, come on. So the third cycle will be always overhead pass and chest pass, okay? So these are one of specific exercise for golfers. It's very, very hard, and you need to choose the right amount of weights, not too heavy, and then gradually to get better and better, heavier and heavier. Thank you. This one I developed just for golfers. Is my Medicine Board golfers abdominal program. Okay? So hook feet, 10 sit-ups and go. Half up and go is 1, is 2, 4, 5, 'To be faster, Clint helps me, and then sit up, and then hook your feet. Come on, sit up, and then side throws. Come on, go lower, and then come on. And then, yes, you have to cover with your hand. Cover with your left hand the ball. Right. 10 times in one side, and 10 times in other side. Yes. When you finish 10, go very fast on the other side and the other side. Please cover with your hand the ball completely. Come on. You go further. Go further. Right. Yes. Good. Half jackknives, 10 of them. You need to do continuously, non-stop this exercise. And now just halfway up and down, because I am who am I?
Sweetheart.
A sweetheart, right. Come on. 1, 2, 3, 4, 5, 6, 7, 10. Again, same exercise, side throw. Come on. The side pass. Cover with your left hand. Cover more with your left hand the ball. More. More on the top. Right. Right. These are the so very important obliques, abdominal muscles, and speed for his swing, and then really helps a lot. And Clint will demonstrate another version later on of this exercise. And 10 in other side 10 times. So it's pretty intensive exercise. Come on. Throw. Cover with your right hand the top of the ball. Very important. Okay, and give me the ball, medicine ball, chest pass, come on, and go, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10, half jackknives, and go. Oh, I'm sorry, I give it to you back. Repeat. Straighten your knees. Oh my God, like my great-great-grandfather. And halfway down, hook your feet, don't stop. Halfway down, sit-ups and go. Halfway down, arms crossed on your chest. 3, 4, 5, 6, 7, 8, 9, 10, okay? And then side throw again, 10 and 10, and go. Cover with your left hand. Cover more with your left hand. 3, 4, 5, 6. Another direction. Oops, do the other ball. Yes, go further from him. Ask him to throw it hard. Come on, come on. 4, come on. 5, come on, throw it. 6, 7, come on. 8, come on. 9, one more. 10, okay, give you the ball and overhead pass, come on, don't stop. And go, and 1, 2, 3, don't stop, come on. 4, 5, 6, come on. 7, be angry a little bit more. 8, 9, and chest pass, come on. Go, and 1, 2, 3, 4, sit up more. 5, 6, 7, 8, 9, and 10 jackknives. And go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. Thank you very much. Clint will demonstrate a few more exercises for golfers. For all of this midsection is so important. The external obliques, your back musculature, the speed in it, the smoothness in the movement. We'll demonstrate with the medicine ball, and then we start right now. So now you stay from there, and then covering with your hand, in that way you throw the ball to me, okay? And go. Yes, and same thing to another direction. Right. Go over with your left hand. Yes. Good, okay. Now, the next exercise, sit down, and then we do now from here with feet on the ground. Push your feet on the ground and then passing the ball to me. No, no. So this is the problem. You pass the ball, you throw the ball in this way, hands on the top. Okay. In this way works all of those oblique muscles. Okay, so go all the way, more, cover more, to be parallel with the, yes, and straight arms. Yes, good. And then we can do this in both directions, so just turn, yes, and then same thing on the other hand, yes. Cover more and try to get more, good. And the next version of this exercise, go back a little bit. Feet up from the ground. Your feet has to be up from the ground. And then this way. So, no, no, not up, parallel with the ground. Oops, not up there, not up there. Here, I need it here. Lower, here, straighten your arms. Right, right, yes, good job. So this is in both directions. So keep with your feet and try to throw it. Yes, come on. Yes, that was very good. Yes, in this way. So you can see that in one side he is better than another side. That's normal. But in the meantime, you need to get it gradually. This is a 14 pounds medicine ball. It's pretty heavy. So you can do the lighter one. But first you need to strengthen all of those musculature previously and to make it to be ready for those programs, okay? Aaron will be very sore tomorrow from this exercise, but that's the way on the beginning. Thank you very much.